So I chose to do my paradigm on an issue that I experienced actually just recently in the nursery side of my job. So I work in the neonatal intensive care unit and then also nursery side as well. So the paradigm that I'm going to speak about today involves an infant that was having issues feeding. And this is something that we do encounter all the time, but something that stuck out to me about this particular infant was that, so this was day two. And typically, for those that don't know, in the nursery, infants are there 48 to 72 hours after birth. And so you don't have a lot of time with parents to kind of get them in a role to where once they discharge, they're able to take care of the infant properly and make sure that it's eating, it stays warm, just all the things vital to keeping an infant safe. And so in this particular case, baby hadn't really had a full meal the entirety of its birth, and it was stressing mom out. And here I am showing up on day two of life. So, not quite yet 48 hours, but it is the next day after the birth. And this is also mom and dad's first child, which I also feel is pertinent to say. So, I go in and I really enjoy working with children and more so babies. And so I'm really good at paying attention to them. And so I asked mom, could I assess the infant? And she agreed. So I assessed the infant to try to figure out exactly like what issues was it having eating so that we could actually get the baby feeding well because at this point it had lost a good percentage of its body weight. And of course, that's a problem. Um, the importance of it that stuck out to me was had I not shown up that day and been there to kind of go through the process of figuring out what was wrong with this infant, what would have happened? Well, I'm not saying that there aren't capable nurses on our unit, but it had already been close to 24 hours and this infant hadn't had a good meal. Would it have gone home barely able to eat to stress the mom out and for infant to have lost a whole bunch of body weight and then, for an issue that to me was fairly simple. So that's why this one stood out to me. Um, and the importance of it is the small things matter just as much as, I don't know, no, the infant wasn't dying. No, it wasn't under any respiratory distress. No, but just, in the hierarchy of things that we need to breathe, we need to eat. And this baby was not able to do that. So that's why I felt like this was an important case for me to do this paradigm case experience on. So if we take a look at considerations and learning outcomes, um, I feel like the in the ANA Code of Ethics, something that stuck out to me as far as this case and the ethics was provision 4 and provision 5. And in provision 4, it talks about authority, accountability, responsibility for nursing judgments, decisions, and actions. Um, Provision 5 talks about duties to self and others, promotion of personal health, safety and well being, preservation of integrity. I feel like Provision 4 and Provision 5 go perfectly along with this case, just due to the fact that we as nurses, we do have roles and standards that we should hold ourselves to. And in this particular situation, could I have just been like, oh, okay, yeah, baby, we'll figure it out. Baby will eventually eat well. It's not, you know, I don't have to really sit here and pertain to this and, stay on this baby when I've got other things that are happening. I've got critical, patients, I've got critical babies. But in this sense, I feel like the criticalness wasn't of importance. It was that this mom needed help, and it was my job to help her solve this problem, no matter how large or small it may have been to someone else. To this mom, it was everything. To the baby, it was everything. This baby literally has not had a legitimate meal in almost 24 hours of birth and is now losing weight. So I do feel like those provisions go right along with why I chose to act. I'm accountable for this patient. This is my patient, this is my responsibility. If it were to go home that day or the day after, what did I do to contribute to mom being able to go home and effectively take care of this, this human, that needs to eat and live. Um, Also, I like how in Provision 5 it states duties to self and others. So I feel like I had a duty to this mother and this infant to not just overlook it and to take it seriously and delve deeper to see, what can I do to help this mom? And if I can't help her and this infant, who can? And all of that goes back to just promotion of personal health, safety, and well-being. Um, at the end of the day, I am here to take care of this infant and make sure that it goes home and it will be well and it will be safe. And so I think it was important that I did act. I did feel obligated to do something. Just I'm a nurse. That is literally my job. I feel like that. I mean, you decide to become a nurse. That's something you take on. You take on taking care of others and helping them with their problems. Doesn't matter how big or how small. And another thing I really love about the nursing profession is you do have that autonomy. There's not like a set particular order in the way I had to do things. It was up to me and my nursing judgment to how I decided to solve this case. The resulting learning outcomes I came to surrounding this case was it's not always life and death. Like I stated before, it was this mom's world. She's stressing. She just had a baby and is not able to sleep. She's worried about baby not eating. She doesn't feel comfortable breastfeeding yet because she knows that her milk isn't in. So we go to bottle feeding and then we proceed to bottle feed and baby still isn't eating. So just imagine, the chaos probably inside this mom's mind, like I'm doing everything wrong, I'm trying to do what's best for my baby until my milk comes in by, give it the formula, and then I can't get it to take the formula either. So I really wanted to fix this for the mother, even though she wasn't particularly my patient. But in the pediatrics world, in the neonatal world, you pretty much have multiple patients. You don't just have the infant, you do have the mother and father and their family or guardian as well. So everything matters. It all matters. And I enjoy making a difference. I guess that was something that I learned from this too, that something so small made such a large difference on not just the mother, but the baby. And it really felt good to be able to help them and spend that time with them and just really get down to what was wrong so that this baby could eat. And then it went on to eat very well for the next 24 hours and was able to go home the next day. So it was just great to see just the continuity of it and to see like, wow, I had an impact on this infant and not just the infant, but the mother as well, to get it towards health and to get it towards being able to go home and thrive. So wonderfully enough, this was something that I could solve on my own. It just really took just extra care. Other nurses, that had probably dealt with this baby in the past, just probably just brush it off as, oh, baby's new, baby's fresh. They don't often eat very well at birth, and it's no big deal. But that was something else I really liked about this case was that literally just taking that extra time to do a little bit of assessment and do a little bit of analysis and implementation and then just evaluate. I solved this problem all on my own, and, baby went on to do well. So the treatment for this was a lot of issues can come about just from babies being born, and a lot of them are simple. So in this particular case, this baby had a tongue tie, or what we call a restricted tongue. So in that, there are different degrees to it, but this particular baby, they're not able to get a good latch on, nipples, on the bottle nipples, on breasts, even for that matter, due to their tongue not being able to create the right motion to get the milk out. So due to this, babies tend to take in a lot of air. They tend to not be able to get a good latch around a nipple or a breast. They tend to be really fussy eaters. They tend to spit a lot. They tend to spit up a lot. And so I'm asking mom all these different questions. And she's like, yes, yes, we are having all these issues. And so I'm like, okay, everything sounds right. I had seen this before. I was like, okay, yeah, this sounds like babies that I've had previously. I don't know why no one had caught on to it before. We have lactation. We do assessments on babies at birth and then, multiple times throughout the day. I'm like, okay, surely it's not just that simple. So I try to get baby to latch on to this bottle, and I'm watching it, and it's just having issues. And I'm like, okay, yes, there's definitely something going on here. Um, so after, going through the nursing process, so I've assessed the baby now. I've, put the bottle in his mouth and saw how it take the bottle. And what I interpreted was that it just could not grasp the bottle. I was looking at his tongue. I did check underneath and saw that it had a degree of a restricted tongue, but I'm like, was that it? Was it, just that simple? So we could just test it. So I felt like I had identified the problem. So I'm like, okay, what do I need to test out, my theory to see if it's this simple and we can get this baby, eating and nursing properly. So I got everything I needed. I told mom what I was going to do, and I'll be back. So I went and got all the things I needed. So I went and got a different bottle. I went and got a different nipple, and we make nipples for this. We have special orthodontic nipples that we use for special cases or babies that have restricted tongues, to all the different level degrees. So I went and got all the materials that I need, and I came back, and mom is like very hopeful, like, let's see how this works. And it worked. I, got it all set up. Baby was starving. So had this baby, I mean, any other feed this baby has taken maybe 5. I don't even think it had taken 10 before. It chugged down 40 mLs in less than 5 minutes. And if you know anything about infants, we typically give them 10 to 15 minutes to take down a bottle. 5 minutes, 40 mLs. This baby was literally starving, and I could just see the relief in mom's face. She was just, almost at tears, that wow, it was something so simple, but nope, she didn't know, so had no one told her or paid attention to this baby, it would have just continued to just starve. So as I reflect back just on the experience and things like that, um, a lot of people say that I'm very patient. Yes, we have a lot of patience in the nursery. Yes, the days are typically very full. I spent a lot of time in here with his mom trying to help her get this baby, to eat, just something so simple to eat. And I think once we kind of like got baby in a good place, I mean, I just had an overwhelming feeling of gratitude of just like, oh, this is why I love the nursing profession. It doesn't matter how big or small, but I made a huge impact on this mom and this infant. And that is really why I really enjoy nursing. So, to conclude my case, I just want to talk a little bit about just influence and making an assessment and what rationale I chose, and also Benner's novice to expert theory. So I am, I guess, a baby nurse, as people like to call it. So I've only been a nurse about 6 months now. And then I did my 2 years of um, my associate's degree. So prior to this, I mean, other than having my own children who none of them had tongue ties, I had no earthly idea what a tongue tie was, how to assess it, how to treat it, what to say to a parent. I just had no idea about any of this. So, at the beginning of all of this, when I first became a nurse, like legitimately my first day, I would have defined myself by the Benner's novice to expert theory as a novice, for sure. But even within these last 6 months and having experienced a lot, one of those things is, you get used to certain things just come up a lot. And tongue ties has, interestingly enough, been one of those things that we encounter quite often. I had no idea how often tongue ties in babies actually were. Um, but through going through assessments and dealing with babies and getting to work it out with coworkers with more experience, as well as just figuring it out on my own, I figured out what works. Now I know what to say to parents. I know what to look for. And my rationale behind that is just, I guess it all just really does come from experience and learning on the job and learning as you go. And I really like that, having read through the novice to expert theory, that I'm not as advanced as I, thought that I might have been, but I still am competent. So, well, no, I'd be an advanced beginner. So I've had enough real world situations that the recurrent component is easily identified when it is related to rules and guidelines. So in practice, I've just seen enough of it now to where I pretty much identify it as soon as I realize, and maybe even more so than others do. But I try to be, as a new nurse, I just try to make sure I don't overlook anything and that I'm catching everything and I'm not, just the simple things, they matter, just those small little details. So I did enjoy reading through the novice to expert theory, and yes, I am happy to say that I am now an advanced beginner. I'm glad that now, due to my past experiences, I can assess and use just rationale and my clinical judgment and things like that to identify these issues. So now I can address them quicker, and hopefully, preferably, things like this don't happen as often in the future, to where we have an instance like this where an infant is struggling, and I can only imagine just, going 24 hours, you're just brand new in this world and having to do all these things on your own and then unable to do something. And it's just so simple that, if we address it and recognize it, that we can solve that problem right away and, help this baby advance to this the next stage in its life, to get to go home, for the mom to be able to bond with her baby and feel like she knows what she's doing, and she's making progress and she knows how to take care of her baby. So just all of it, when you put it together, it's just really a great thing. Thank you.